So the meeting is being live streamed. Don't panic, nothing to worry. Everything is fine. Okay, same thing what you have done now, same thing you have to do. So the meeting is being live streamed. Yeah. So now let us see here the question paper. So page number 2. Yeah. Kamalesh, Inteti. See
Yes,
here.
sir.
Fractures, dislocations, and sprains. I'm teaching
Yes,
only first 7 questions now. Fractures, dislocations, and sprains. Text A
Okay,
is about types. So text A is
Right.
talking about types. Text A is
Okay.
talking about categories, types. You understand? Categories, types, classes, groups,
Yes,
like
sir.
that one. So first A is categories. Any name you give, whatever name you want to give, you give. That is your right. Okay. You
Okay,
can
sir.
say classes, you can say groups, you can say types, you can say anything you want. So first one is categories. 3 categories are there: fractures, dislocations, and sprains, right? Then second
sir.
one is fractures. Simple fractures, you are managing, you are assessing, and you are managing. So it is management. Okay. B is
Okay, sir.
management. Is that clear?
Yes, sir.
The title is fracture, dislocation, and sprains. There are 4 groups, 4 rooms. First
Okay,
one is categories, second one is management. And next
Yes,
one,
sir.
third one is drugs. Third one is drugs, analgesia, medication, drugs. Analgesia, medication, drugs, therapy, all these things, any name you can take. So it is C is drugs. A is categories, B is management of simple things, C is drugs, D is plaster for serious fractures. Simple fractures management, D is serious fractures plaster. A is categories, C is drugs. A categories, all 3 categories. B is management of simple fractures. C is drugs for everything. D is plaster for serious fractures. So that's very clear now. So now let us go to D. D is back slab, plaster back slab. D is plaster back slab. Is that clear?
Yes, sir.
Now no need to see anything else. Don't see anything else. Now I am going to give you the questions. Okay, first one, procedure for delivering pain relief. Procedure for delivering
C.
pain relief. A or B or C or D?
C.
C. Okay, I'm taking you to the answers. 26. So, yeah. Yes. Answer is C. Is that correct?
Yes, sir.
Answer is C. Correct. Next one. I'm taking you to the second question. So, in which text can you find information about the procedure to follow when splinting a fraction lip? Is it A, categories, B, management, drugs, D, plaster?
Yes, sir.
Which one?
Splinting D.
Splinting D. Okay, now let us check whether it is D or not. Sorry. (26). Yes, 1C. Second one is D. Is that correct?
Correct, sir.
Second one is D. Now let us go to the third question. Third question. What to record when assessing a patient? Assessing a patient. What to record
B.
when assessing a patient? Which one?
Management B.
Management is B. Very good. You remember the words. Okay. You remember which one is A? A is what?
A categories.
Category. Okay. B is what?
Management.
Management. And C is what?
Drugs.
Drugs. D is what?
Plaster.
Plaster. You have to remember these things. Okay. So first one is over. Second one is over. Third one, what to record when assessing a patient? So the answer here is C. That is B. Your answer is right or wrong?
Right, sir.
Very good. That's the seriousness. Next one, fourth question. The terms used to describe different types of fracture. Come on, fast.
A categories. A.
Terms, types, categories. Okay. Now let us go to the question. Categories. Fourth one is D, you say. Fourth one is categories. A, you told. So A is right. A is right. Next one. Question number 5. The practitioners who administer analgesia. A, B, C, D. Come on.
C.
Analgesia. What? Analgesia
C.
means?
Drugs. C.
Drugs. So A, B, C, D. You say C. Okay, now
C.
let us take. Yeah, fifth one is C. Right answer. The next one. Sixth one. What to look for when checking an injury? Checking. Is it in
B.
types or management or
Management, sir. B.
your management? What is the answer? A, B, C, D. Come on, first.
B. B.
B. Okay, B. So let us check B. So sixth one is B. That's absolutely right. Then seventh one. How fractures can be caused? Yeah, how fractures can be caused?
Cause A, sir.
A.
Categories.
Why A you think? Why is it A? Do you think?
Description of the fractures. They have
Description of the
categories. They
fractures.
have
Different
described.
types or different characters. Yeah. So you say it
Yes,
is
sir.
A. So now let us check. So seventh one is A. So now you got all the 7 answers right?
Yes, sir.
So how do you feel? Do you think any tension for this one?
No, sir. Rapid.
No tension, right?
Yes, sir.
Did you think that such a technique existed? Yes or no?
No, sir.
Before, did you have an idea?
No.
Did you read any passage? Did you read anything?
No. No,
Without
sir.
reading the passage, did you get all the 7 answers or not?
Yes. Yes, sir.
This is how it is. You understand now? If you come to me, I can help you. If you don't come to me, I cannot help you. You are a doctor. But how can I help you if you don't come? If I am a patient and you are my doctor, if I come to you, then you can give medicine, you can assess, you can do everything, right?
Okay, sir.
If you don't come to me, how can I give you medication? Difficult. Is that clear?
Yes, sir. Yes, sir.
So now this is the same pattern you have to apply for all the other questions also. Is that clear?
Okay, sir.
So now I am giving you the next set of questions. Only one question I'll give you, okay? Only one question
Okay,
I'll give
sir.
you now. Let us see how it goes. Now, let us go to next question. 1 second. Yeah. Eighth question. This is 15. So eighth question is here. Here you can get the answers also. You can see, check the answers A, B, C, D. What is it? You can see.
Okay, sir.
So this is question number 8. 8 is here. So now let us see questions. These are the questions. Okay. Now question number 8. Now see, what should be used to elevate a patient's fractured leg? Yeah, tell me. A, categories. B, management. C, medications. D, plaster. What do you think? Where do you think you will get this answer?
Plaster back slab.
You will get it? Plaster back slab. Do you think it is in plaster back slab?
Or management.
It's management. Okay. What should you use to elevate? Elevation is just a management. You're not plastering, right?
Okay, sir.
So you will go to A or B or C or D.
B, management.
So you go to B, management. Okay, now let us see management. Okay, management. I'm taking you to management. See here, management. So is it there at the bottom? Management.
Yes, sir. Elevate the limb.
Now there you go and find the answer. Do you need to read these things? No need to read everywhere, right?
Yes, sir.
So now tell me, what is the answer there? Leg.
B, management.
Elevate the leg.
Elevate the limb.
The
Management.
leg with what?
A sling for arm injuries, a pillow for leg injuries.
We don't want arm injuries. We want only leg injuries. Tell that answer. I don't want all reading
Pillow.
everything.
Pillow,
Pillow
sir.
or a pillow?
A pillow.
A pillow is there, so right as it is, na? Is that
Okay,
clear?
Yes,
Next
sir.
one. You understand now how to do?
Yes,
So
sir.
now next going to the second one. 9th question. What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? Where will you get this one? A, B, C, D, categories,
C,
management,
sir.
medication,
Drugs. C,
C, drugs.
medication.
Then you go there. Maximum dose of morphine per kilo of a patient's weight that can be given using an intramuscular IM route.
Yes,
Maximum dose per kilo. Maximum dose per
sir.
kilo intramuscular route. Go to C, medication. See there. Check it out. Intravenous will
Maximum
be IV, correct?
10 milligrams.
Huh?
10 milligrams, sir.
Maximum dose per kilo, not total overall maximum dose. Maximum dose per kilo he is asking.
Yes, 10 milligrams per kg, sir. Maximum.
Intramuscular.
Intramuscular, first one, sir.
First
10
one.
milligrams
What
per-
is the amount?
10 milligrams per kg.
10 milligrams is not per kg, my dear. Overall maximum of 10 milligrams. You cannot give more than 10 milligram to any person. That is the meaning.
Okay, one, sir.
Per kilo, how much? See here,
0.2.
don't get panic. Don't get panic. 0.1 is the minimum. 0.2 is the maximum for kilo.
Yes, sir.
This is the maximum per kilo to a maximum of 10 mg per person. You understand now?
Okay, sir.
You got it?
Yes, sir. 0.2
This is the
milligrams per
maximum per
kg.
person. That's all. But this is 0.1 to 0.2 milligram per kilo. You understand?
Okay, sir.
And any time for an individual should not exceed 10 milligram. That's the point. So minimum is
Okay.
0.1, maximum is 0.2. So now tell me, what is the answer?
0.2 milligram per kg.
0.2. Is that clear?
Yes,
Be
sir.
very careful, Kamalesh. Be very careful, okay? You are a doctor. You have to be very careful and you have to be cautious, okay? Right?
Okay, sir.
Don't get angry. This is my style of teaching, okay? That is why your
Okay.
friend Dr. Satya has recommended you to me, okay? So these
Okay,
are the
sir.
4 subtitles. Now let us see here. Fourth question. Where is it? Yeah, question number 10. Question number 10. Yeah, this is the table, okay. Now medications, okay. Question number 10. Which parts of a limb may need extra padding? Tell me. Which parts of a limb may need extra padding? Extra padding for what? Categories, management, medication, plaster, backslab.
Management, sir.
My dear, careful. Which parts of a limb
Backslab
may need
or
extra padding?
backslab, sir. Plaster.
Be very careful, okay? Be very careful. Think twice. No need to hurry, okay? I will hurry you, but you should be careful, no?
Okay, sir.
If I chase you, that doesn't mean you should go and fall down in a ditch. You understand?
Okay, sir.
You have to look forward also, okay?
Yes, sir.
Being afraid will not help you. You have to learn how to speeden up the process. Okay, now, which parts of a limb may need extra padding? It is not in category, it is not in simple management, it is for serious. Extra padding means serious, no?
Yes, sir.
So it's serious management.
Backslab.
Backslab. So
Plaster.
now D is the answer, right?
D, sir. Yes.
Now go to D. Now go to D. Yes, there D. D is here. Now tell me, extra padding. Come on. Point number 7.
Okay. Bony prominences.
You have to be very fast here. You have to see where it is extra padding. It is there direct. Same words are there. If you
I was
cannot
looking the second point, sir. Padding was there. I was checking that.
Yes. Second point also will be there. Everywhere will be there. Extra. That is just normal padding. Okay. Extra
Yes, sir.
padding. Okay. Additional extra. Okay. Now say, tell me which is the answer. Which are the areas?
Bony prominences.
Very good. Is that clear now?
Yes, sir.
So 10 answers are enough, no, for you. Remaining you can
Yes,
try,
sir.
right?
Yes, sir.
What should be used to treat a patient who suffers respiratory depression? Okay, treat means treatment, correct?
Management, sir.
A patient who suffers respiratory depression. Okay, what should
Can
be
be
used
in
to
B or C, sir. Management. Management, I'll check first.
Management
But-
you want to check properly. No, respiratory depression is there. A problem is already there. What
Drugs.
should be used to treat? Management means general management. Okay.
Medications.
See, go there. So now you'll go to medication. Come on, tell me. Respiratory depression. See there.
Give naloxone.
Huh?
Naloxone, sir.
Naloxone. Is that clear now?
Yes, sir.
Clear, no?
Yes, sir.
Next, medication 2. So here you will not go. There you will get it. Naloxone, right? Next one. Question number 12. What should be used to cover a freshly applied plaster backslab? Where you will get ABCD? Come on, fast.
D, sir. Plaster backslab.
Okay, D. Okay, plaster blacks is D. Now here is D. Yeah, come on.
Crepe bandage.
Crepe bandage.
Pump.
Okay, crepe bandage, right? Got it?
Yes, sir.
Okay, next one. Okay, whether they are right or not, afterwards we can check. That is a different thing. So 13. 13. What analgesic should be given to a patient who is allergic to morphine? Where we will go?
Drugs.
A, B, C, D.
C.
C, medication.
Medication.
Okay, C, medication. Going to medication. Yeah. Medication here or here? Yeah.
Next one, sir.
So previous one. Yeah.
Previous one.
Yeah. So question number 13. Once again, see question number 13. Yeah. So what analgesic should be given to a patient who is allergic to morphine? So morphine, allergic to morphine, supplementary medication. Yeah.
Okay,
allergic to morphine.
Is not there here, sir.
Huh?
It's not there here, sir.
Here?
No, sir.
Not there. Okay. So now let
We'll
us
check in management, sir.
Yeah, 1 minute, 1 minute. Yeah, this is complete one. Check it out. Is it here?
No, sir.
Okay, management. Check it there.
Use fentanyl.
Management. See there, management.
Fentanyl, sir.
Last one.
Management part they have given.
So use
Allergic to
fentanyl.
morphine. Fentanyl.
You got it here.
Yes, sir.
Okay, next one. So it is management. Okay, management or drugs medication. There you have to see. Then next
Okay.
one. So question number 14. What condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia? Where will you find this one? What condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia?
I'll check in management, sir.
So you will check in management. Okay, we'll go to management. Yeah, this is management.
Compartment syndrome.
Very good. Excellent, excellent, excellent. That's fast. So you need not see everywhere, na?
Yes,
So
sir.
that's the point. Next to 14. 14 over. Then now we'll go to 15. Yeah, falling on an outstretched hand. Falling on an outstretched hand is a typical cause of a dash of the elbow. Categories.
Categories.
management,
Categories
fracture,
I'll find.
yeah.
Categories A.
Categories A. So falling on an outstretched hand. So let us see falling on an outstretched hand. So A, come on.
Dislocation. Elbow dislocation.
Elbow dislocation. Elbow dislocation.
Dislocation.
Yeah, right. Then next one. 16. Can you see here there? Cause. Cause means.
Yes, sir.
Cause means again types, right? Categories, right?
Yes,
Next
sir.
one. 16. Upper limb fracture should be elevated by means of a upper limb fracture.
Management, I'll check, sir.
For this one, you will go to
Management.
management. Do you, for this question, you did not go there also, correct?
Yes, sir.
Recall what you will give. You're an experienced doctor. Without this, going to the passage, tell me.
Should be elevated by means of some splintage will be given, sir.
They will be given, but what? You tell me, na, roughly. Hand has a fracture. What will you give?
Should be elevated
Elevated by what?
by
It
giving
starts
some
with the
fraction.
word yes.
Splint, sir.
Letter S. Huh?
Sir.
It starts with the letter S. Yes. Yes. Okay, you're not able to guess. Okay. B. Yeah, tell me now. Wherever you got leg, there only you will get
sir.
results. A sling.
Sling,
Okay.
sling. A sling.
You are treating patients. You should recall that word immediately. Okay. Without seeing,
Yes,
you
sir.
can write actually this one.
Yes, sir.
Next one. 16. Okay, 16 over. Okay, 17. So see how elevated by means of elevated is the word. Make sure the patient isn't wearing any dash on the part of the body where the plaster backslab is going to be placed. Where is the answer? A, B, C, D.
B, sir. Management.
See the
Oh,
question
D,
properly,
D.
my dear. See the
Backslab,
question
sir.
properly. Plaster backslab is
Plaster
given, no,
backslab.
they are already.
D. D,
Go
sir.
to D. Go to D. Plaster backslab. Check. What is
Jewelry.
the answer?
Sir.
Okay, once again, I'm showing you the question. Wearing any dash on the part of the body. Wearing something on the part of the body, okay? Yeah, check it out. Wearing something. You came to plaster backslab, very good. That is quite correct. Next one, what?
I think jewelry, sir.
Yes, absolutely right. Jewelry. You wear jewelry or clothes. Okay. Next one, 19. In a plaster backslab. Okay. Check to see whether swollen limbs, 18th one, right? 18th.
Yes,
Check
sir.
to see whether swollen limbs are dash of or increasing in size. Check to see whether swollen limbs are dash or increasing in size. A, B, C, D. Which one?
B, sir. Management.
Management. B. Okay. Increasing in size. Remember.
Yes, sir.
So management. See, this is management. Yeah, check it out.
Limb. Check to see what, sir? Color.
Check whether. See, check whether. Increasing in size means what?
Swollen, sir. Swollen.
Okay. The swollen limb is increasing in
Throbbing or
size.
getting.
Increasing in size means getting bigger. Or another word.
Throbbing or getting bigger.
Getting bigger means increasing in size, right?
Increasing in size. Yes, sir.
Already that word is there, no?
Yes, sir.
Increasing in size, getting bigger is already there. What is the other word?
Throbbing.
Yeah, that is the answer, right? Next, 19th. In a plaster backslab, there is a layer of dash closest to the skin. Where will you get this one? A, B, C, D.
D. Plaster backslab. D,
Plaster
sir.
backslab. Closest to the skin, what is the layer? Okay, plaster backslab. Yeah, closest to the skin. What is that closest to the skin? What should be the first one?
Closest to the skin.
Closest to the skin will be first one, right?
Yes, sir.
What is that? See the first point.
I did not get the question, sir.
You did not get the question. Okay. Okay, 1 minute. In a plaster back, there is a layer of dash closest to the skin.
Okay, sir. Cotton stockinette.
Non-compression cotton stockinette.
Cotton stockinette.
Okay, that is the first
Yes,
one.
sir.
Above that one, cotton padding will be there.
Yes,
Right?
sir.
Above that one, plaster of Paris. Correct
Yes,
or
sir.
not?
Yes, sir.
Then afterwards, extra padding, right?
Yes,
So
sir.
like that. You have to think like that one. Okay. Now 19th question over. 20th question. Patients aged and over dash. Patients aged and over dash shouldn't be given the higher dosages. Aged and over dash, what is the number of years? So given the higher dosages of pain relief, higher doses of pain,
Medications.
your ABCD.
C, sir.
Okay, C. Okay, C. Which one you'll get?
70
C.
years.
Yeah. Where you'll get, here or here?
Previous one, sir. Yeah, 70 years.
So 70. Very good. 70 is equal to less or minus. You should write or you need not write. This
No,
symbol.
70 years, no.
This is needed or
Already
not needed?
not needed, sir.
Why not needed?
Already aged, they've given equals.
Aged and above, he told.
Already they have written.
Over, he told. Age is equal to and above. Both are there, right?
Yes, sir.
Correct on it.
Yes.
Huh?
Yes, sir.
So
Yes,
years
sir.
is required or not required?
We have tried, sir, 70 years.
70 years. Aged and over 70 years. Shouldn't be given. Is that clear now?
Yes, sir.
Understood?
Yes, sir.
Huh? Okay.
Yes,
Any doubts you have?
No, sir.
How do you feel? What's the speed of our vehicle?
Yeah, this was quick, sir.
Huh? Is it rapid fire
Compared to
round or
my-
no?
Yes, sir.
Yeah.
That was
Now I
rapid.
want you to give your genuine. Open your video. Okay, 1 minute. Yes, you can open your video. And now I want you to give your frank opinion on today's session. Give me your suggestions. Okay. Give your suggestions and how you felt. Was it difficult or was it easy? Did you think that? So, okay. Now tell me. Give your opinion.
Today we had a session on reading part of the OET test, specifically on part A of the test. So after taking the class, I feel that it is rapid. I can clear the answers very rapidly compared to my previous session, previous practice. So this was very helpful, and I would like to apply this all the tips given by Simon sir over my coming practice on the reading session. I thank him.
Okay.
Thank you, sir.
Yeah. How did you come to know about classical corrections or Mr. Peter? Who informed you or how did you come to know through classical corrections channel or YouTube videos or how did you come to know about this?
So I came across Simon Peter sir through one of my colleagues, Dr. Satkumar sir. He endorsed me, Simon sir, because of his exceptional pass percentage in the OET exam. So he suggested me that he's a good mentor and he'll help you in achieving your desired results. So I trust him and I believe in Simon sir that he will guide me in my steps in achieving my result.
So who is Mr. Satya actually? Your colleague
Satya.
or your friend or your senior
Yeah.
or your boss?
He's a colleague of mine working in the same hospital. He is head of the department of orthopedics. And, I've been working with him for about 3 years.
So now, based on all this practice, how do you feel? Do you get confidence? What level of confidence are you able to get?
Yes, sir. I feel confident and I feel positive in doing this reading test, especially. I'm very much positive and looking forward for more sessions, sir.
Okay. So today you have got the lecture how to do part A. So part
Yes,
A, how you have to separate it to 4 groups. Okay.
Yes,
And give a title. Give a title to that one. Based on that title, you read the question, one word relates to the title. So immediately go to that paragraph. Just write first to 7 answers. You don't need to look at all. And 8 to 20 answers also, you don't need to bother about at all. Identify which part it is and just then go 8th question to 20th question. First you identify like 1 to 7 questions, same manner you identify which part, then you go there directly, get the answer, come off. That's all.
Okay, sir.
So you can finish it in 10 minutes maximum.
Yes, sir.
Okay. Practice well, practice well. Okay. So tomorrow
Yes,
we will do part B. Okay.
Okay, sir.
Tomorrow we'll do part B. And today, as many part A's you can do, you try like this.
Okay, sir.
But don't do it on the computer, don't do it on the phone. Take hard copies, keep them with you and do them.
Okay, sir.
I think you already got the printouts, right?
Yes, sir. I got reading.
Take only part A today. Take only part A today and study. And if you face any problems afterwards, you can ask me. Put a question mark there. Afterwards, you can ask me. Is that clear?
Yes, sir.
So tomorrow is Sunday. So tomorrow, if you are free, are you at home or you are at work?
I have some work, sir. Evening I'll be free, sir.
Okay. So then tomorrow you take rest, no problem. Day after tomorrow we'll meet. Okay.
Sure, sir.
If you are comfortable tomorrow evening, you can call me, no problem. But before calling, you clear all the doubts in part A so that we can start part B fresh. Okay.
Okay, sir.
Without practicing this, don't come to part B because again it will be confusion both of them, right?
Okay, sir.
Okay, one last point. For example, yeah, I'm going to take some students. Maybe you have some friends. Suppose your friend is asking you, I want a good teacher. So would you like to recommend Grandmaster class or just your why? I am your friend. I want to study OET. Now you explain me why you want to refer my Mr. Peters classes.
Yeah, I feel more positive and I've learned a lot. Learning by mistakes is one of the skills which you have given me. So you encourage me to practice more so that you become better day by day. So you are one of the good mentors I have came across. So your corrections are till now I was thinking that only I can by practice, by self dedication only I can pass the exam. But by knowing the mistakes, I've I came to know that a good mentor and guide who is skilled in English is necessary to to pass such an international exam like OET or IELTS. I would endorse this to my friends because they need to be corrected and a skilled person like you, I would definitely recommend you.
Yeah, now one last point. There are many doctors who think we have finished master's degree, we have finished bachelor's in medicine, we have completed, so we studied so many books, we can just do it without we can practice on our own and we can get, definitely you can get, that is not a problem. But yes, the techniques and strategies which you have attended and you have learned, could you be able to learn and will you be so confident if you do it on your own?
No. This could not be learned by self motivation or something like that. Definitely, most of them tend to watch a lot of YouTube videos and learn from them. But person to person, one to face interaction and one to one correction is not available by watching those. You need to know where you are weak, the areas which you are weak, and the support will be definitely coming from the guide.
Okay.
Especially in English.
Right. Thank you very much for your feedback, because there are many people as a doctor, when you give say your feedback, maybe there are many nurses and other professionals, because doctor is the leader of the team. You know that very clearly. Pharmacists, all others are following the doctor's line. So your feedback will definitely influence the other nurses and other many people who are your juniors and subordinates. They will be influenced by your words, because as a doctor, if you feel that after knowing a lot of things, after studying so much, so many books, after reading so many books, you think that these techniques are very essential and they will enhance our skills and they will speeden up our process of finding out the answer. You have seen as it now. Within seconds, you have given the answers, right?
Yes,
Within
sir.
seconds, you have given the answer. So if you practice more, you can finish in 5 minutes. Correct? So
yes, sir.
then you tell, then automatically, then what about the other? There are many people who are telling nobody can teach reading, nobody can teach listening. You have to learn on by yourself. Nobody can teach like that. They are giving false message in the public, and they teach
Yeah.
only writing, and they teach only speaking something, and just they manage things. That's all. So that is not the right concept. People can understand through your message, maybe like because they trust the doctors, they believe that doctors are more knowledgeable normally. So definitely, yes, of course, there are even nurses who are knowledgeable than doctors. That is a different thing. Okay, the subject is different, right? Medicine language is different. English language subject is totally different. There are some nurses who speak very effectively, efficiently, then even better than doctors. That is there. That's different story altogether.
Yes, sir.
But definitely, I appreciate and I expect you to provide at least two B's, two A's for me. Okay,
Sure,
if
sir.
you work hard,
Sure.
you can get definite. All four A's also you can get. At least B plus also is fine. Okay, work
Yes, sir.
hard,
Sure.
get good for me like Mr. Satya. Okay,
Sure, sir.
okay, dear. Thank you very much. Have a nice day. Bye bye.
Thank you, sir. Thank you.